All right. Well, welcome everyone. I am Colleen Cordes, Assistant Dean and Clinical Professor of Behavioral Health at the College of Health Solutions. And relevant to today's talk, I am also a licensed psychologist trained in integrated primary care behavioral health. I'd like to thank you for joining our Health Talks webinar brought to you by the College of Health Solutions at ASU. The College of Health Solutions addresses the challenges facing people in communities to stay healthy, improve their health, and manage chronic disease. These health talks are one way that we serve the community with timely and relevant educational content that also provides continuing education credit at no cost. Before we get started, a few housekeeping items. First, this session is being recorded and it will be posted on our website, asuhealthtalks.com. After each of our panelists present, I will moderate a Q&A session. Please submit your questions using the Q&A feature and not the chat box. Finally, you will receive a brief survey asking for your input about today's webinar. If you are requesting continuing education credits, this must be completed in order to receive that credit. And if you did not apply for CEUs, we'd still appreciate your feedback in order to improve our series. Today's topic is the health of the healthcare workforce. And joining me today are Dr. Keith Frey, who with over 35 years of experience as a primary care physician, educator, mentor, and researcher. Dr. Frey is a physician executive and academic leader with strong clinical informatics, business, and leadership skills, and is the current chief physician executive with Dignity Health Arizona. In this capacity, he's responsible for driving clinical excellence, superior patient experiences, academic integration, and physician leadership development. His career also includes major leadership roles at Duke University, Providence Health, the University of Washington, and Mayo Clinic. And we are very fortunate to have Dr. Frey as a professor of practice with the College of Health Solutions. Dr. Frey will be followed today by Dr. Terry Pipe. Dr. Pipe is an expert in mindfulness, which is a skill set to increase the ability to be fully present, focused, and alive. She is a professor at ASU and founding director of the ASU Center for Mindfulness, Compassion, and Resilience. Dr. Pipe is also Dean Emerita of the Edson College of Nursing and Health Innovation, where she served as Dean from 2011 to 2018 and as ASU's inaugural Chief Wellbeing Officer from 2017 to 2021. Her career also includes serving as Mayo Clinic Arizona's Director of Nursing Research and Innovation for 11 years. We are so fortunate to have both of these health leaders with us today, and we'll go ahead and get started. I have the privilege of getting us started by kind of grounding us a little bit in what we're going to be discussing today. And so, as I mentioned, our talk today is on the health of the healthcare workforce. Excuse me. My apologies. All right. So as we talk about the health of the healthcare workforce, what do we mean by health? Oftentimes in the time of COVID, we have been talking about health in terms of physical ailments. But the World Health Organization actually defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmary. So as we talk about health today, I want you to think about health holistically. Another topic that we're going to talk about as we discuss the healthcare workout is the topic of burnout. Now, burnout is an occupational phenomenon, not a medical disorder, although it is in our ICD-10. And burnout is an occupational phenomenon resulting from chronic workplace stress, which is characterized by feelings of energy depletion or exhaustion, increased mental distance from one's job, including feelings of negativity or cynicism related to their job, and reduced professional efficiency. And this is important not only because burnout in and of itself can cause problems of absentee and presenteeism at work, but it's also significantly associated with depression and anxiety. Every year, the American Psychological Association conducts a survey that examines the experience of stress in America. And it's probably not surprising to anybody that 2020 and 2021 have provided unique stressors not only to healthcare professionals, but the country in general. And I think it's important to kind of lay some of that groundwork and provide some of that context, because not everybody has been impacted equally by the syndemics of both COVID and racial injustices that have greatly influenced our overall stress in the United States. In 2020, 67% of Americans reported increased stress due to COVID. Interestingly, our Gen Z population, so those individuals 18 to 23 and perhaps just launching into the healthcare professions, reported the highest levels of distress. So especially for our younger healthcare workers who are working with populations for the first time, they are at greatest risk for experiencing distress as a result of COVID. But regardless of age, almost 20% of Americans reported worse mental health in 2020 than they had in 2019. When we drill down a little bit specifically, school closures had a really profound impact on the larger population, many of whom were also healthcare workers, with 70% of parents reporting family responsibilities as a significant source of stress, and 59% of adults, regardless of race, reporting police violence towards minorities as a source of stress in 2020. So it's clear that the COVID pandemic has impacts on stress and mental health from familial, economic, and societal pressures that have been compounded. And it's important to recognize that the stress experienced by healthcare workers is further complicated by their individual lived experiences. This becomes important because stress, while often considered initially to be kind of a cognitive concern, worry, anxiety, it does have both short and long-term physical impacts that influence the totality of somebody's health by how the World Health Organization defines it. As we talk about healthcare workers, it's important to note that we may be using that term broadly, but they are a very heterogeneous population. And like all people, their lived experience are influenced by diverse identities that they hold. I personally really gravitate towards Pamela Hayes's addressing model of diverse and intersecting cultural identities. That look at how age, developmental or acquired disability, religion, ethnicity and race, socioeconomic status, sexual orientation, indigenous heritage, and nation of origin and language, as well as gender, come together and may additionally exacerbate stressors experienced by the healthcare workforce. As I said, whose definition of health is multifaceted, as are people. And so it's important to look at this highly heterogeneous population, encompassing not only diverse professional backgrounds, but diverse identities that intersect and influence one's lived experience. So consider, for example, a Hindi emergency room doctor. She's a single mother with school-age children whose schools were closed for much of 2020 and 2021, making it difficult to navigate work in a high-risk environment while also trying to ensure her children were homeschooled. Or a young trans male primary care doctor who'd been saving up for gender reassignment surgery since graduating from medical school, but his surgeries were continuously postponed during the pandemic because they were considered elective. Or a Black surgeon from Minneapolis whose father contracted COVID early in the pandemic and subsequently passed away. Versus a newly minted psychologist who came to the United States for graduate school and wasn't able to go home to see his family in Mexico for almost a year because of travel restrictions. Or an Apache nurse who was hired as a traveling nurse right before the pandemic hit and has worked in 6 different hospital systems since March 2020. In their whole, and when we think about those diverse and intersecting identities, the healthcare workforce has been extraordinarily impacted over the last 2 years. In that same Stress in America survey from the American Psychological Association that was done this year, essential workers, which in their analysis included not only healthcare workers, but other essential workers, they were more than twice as likely to be diagnosed with a mental health concern during the pandemic than non-essential workers. And this is particularly important because 75% of them indicated that they could have used more support. They weren't getting the help that they needed to navigate these incredibly challenging times. When we look specifically at hospital-based healthcare professionals, more than 60% reported experiencing burnout in spring of 2021, compared to 30 to 40% in spring of 2020 when the pandemic had first hit. And those who were greatest risk of burnout among the healthcare workforce were individuals who were under the age of 40, female, working directly with COVID-19 patients, and were deployed to new work areas. So what do we do about this? Dr. Frey and Dr. Pipe are going to both give you some opportunities and ideas for how we can support the health of the healthcare workforce. As a psychologist, I always think it's important to reiterate the importance of behavioral health services for depression and anxiety and other mental health concerns. So if you are a healthcare worker who is in that 75% who feel like you need more support than you have right now, please go seek treatment. The American Psychological Association and the Arizona Psychological Association both have Find a Psychologist features on their website, but there are a diversity of mental health provider backgrounds who might be able to provide you some much needed support. Specifically with burnout, though, it appears that in addition to managing some individual interventions, organizational interventions really have the most profound impact. And so targets for intervention from an organizational level are ensuring that there are adequate staffing in an effort to kind of reduce issues of overtime or scheduling shifts, that are problematic. Empathic leadership support has had a really profound effect by building on support networks and providing people an opportunity to kind of manage some of their moral distress. Another thing that we saw in COVID amongst healthcare workers is that many healthcare workers were being deployed to new environments, both in terms of geographical environments, but maybe moving into roles and opportunities that they weren't previously engaged in a regular way. And so providing training in an effort to increase one's confidence in their ability to perform relevant tasks on the job has also been demonstrated to be effective. With that, I'm going to hand it over to Dr. Frey.
Well, thank you, Dr. Cordes. Excellent overview, and I think you'll see that my slides and comments will integrate very nicely with yours as well. And let me go ahead and pull my slides up. I want to, first of all, Dr. Cordes and the College of Health Solutions, thank you for the opportunity to join you today and to speak from the delivery side. And Dr. Pipe, always a pleasure to share some time with you. We've known each other nearly 20 years and had a chance to work together in a variety of opportunities. So always a pleasure. And Colleen, can you see my slides adequately so I can?
We can, thank you.
All right, well, thank you so much. As introduced, Keith Frey, I'm a family physician by background and currently in a senior executive role at Dignity Health, sitting here in Phoenix, Arizona today. For those that are just briefly maybe not familiar with Dignity Health, our parent company, as you can see from my logo there, is Common Spirit Health. We're the largest nonprofit faith-based company in the United States. We operate about 160 hospitals across 23 states in the United States and touch about 1 in 4 Americans. Here in the Southwest, I have responsibility for both Arizona and hospitals in Southern Nevada. So we have roughly here in Arizona, I'll focus my comments on 8 hospitals, 6 here in the Metro Phoenix area, from a quaternary hospital, the oldest hospital in Phoenix, St. Joe's Hospital Medical Center, to tertiary hospitals, to a number of community and general hospitals. We have a workforce of roughly 20,000 here in the Southwest, and about 2/3 of those are direct frontline physicians, nurses, respiratory therapists, pharmacists. So we have a very big workforce. We're the 2nd largest system here in Arizona behind Banner. So just to build on Dr. Cordes' comments, maybe just some additional data that we've taken a look at this year. And though I'm going to focus my comments here primarily to start on the nursing, the RN workforce, particularly the bedside nurses that Colleen commented on. We believe in our data is maybe not quite as robust for some of the other clinical categories like physicians, but our experience is that I think what you'll see here is emblematic of the stress point that our current clinical workforce is under, as we're certainly here in the Southwest now in our third COVID-19 surge, which is a more sustained surge during this period of time, is really putting a stress not only on our systems, but on our people who provide heroic care for each of us each and every day. If we take a look at a sample from a vendor that we use, about 100 systems across the country use. It's a point of care tool that nurses and doctors and others can do a quick assessment of their own personal well-being. We did a look back of that national cohort earlier this year. So we have an N of about 3,200 there. So a recent statistically sound look at the workforce. And this is de-identified data, but we can see with de-identified trending what's happening to the workforce. And again, this is nurses, but emblematic for the rest of the workforce. In this particular tool, if a individual nurse scores higher than 2, there's a series of questions that aggregate to a score, a single score. If they're greater than or over 2, they're in what they would call distress. We look at that group. That's about half of the nurses out of this 3,200. And that's certainly our experience here regionally, that a good 50 to 60% of our nurses at any given time would identify themselves in stress or distress. As Dr. Cordes has commented, this is particularly, it's across all ages, but particularly the younger nurses are having the biggest level of struggle. A lot of reasons for that, I think that Colleen outlined. Though 90% of the workforce is female, there's no gender difference in this group. And one of the opportunities that we like about this particular tool is that there are, in addition to sort of self-assessing one's relative level of burnout or emotional distress, there's also tools that they can click into, do some point of care for themselves. And we get a look, again, we can't identify individuals, but we see some trending where the number 1 category across the country is on the topic, not surprisingly, of stress and resilience. Emotional concerns comes in second, and relationships and work-life balance. We continue just to look at this cohort again as a sort of a biopsy of what's going on right now. These nurses, they're at almost a 6-fold higher risk of burnout. So just being in distress, like any of us day to day, maybe driving in traffic doesn't necessarily mean we're burned out, but they're at obviously a much higher rate and risk of burnout. Additionally, severe fatigue is a pretty significant issue in this group. A poor overall quality of life, much higher. We're seeing this as the workforce begins to shrink. People have just had enough and they're leaving healthcare for other careers or just needing for emotional or personal reasons to step away for a period. So we're really, really struggling across the country and regionally right now with having an adequate number of nurses, respiratory therapists, critical care doctors. Absenteeism, that we sort of see this as an indication that people just sort of are calling in for a mental health day or they're calling off. They may be physically ill, but more commonly they're emotionally ill and they need some time off. And we certainly know from the literature over the last decade, and certainly our observation is that when you're highly stressed and burned out, your job performance, of course, reduces and the error rate increases, and that's not good for really the individual professional or for the patients they're serving. So maybe just to build on Dr. Cordes' comments, sort of what our team is sort of seeing and is true across, I think, the landscape is really this term of psychological trauma, a sense of feeling broken, really. You know, healthcare professionals have experienced enormous levels of stress during this COVID-19 series of surges over nearly the last 2 years, and have experienced, and we are working with folks with various levels of psychological trauma. And of course, I think if you're not directly in healthcare, you probably appreciate why this is. A lot of exposure to death in a pretty short period of time. I make rounds periodically in our hospitals. You talk to nurses, particularly, you maybe see more death in a year or 18 months than they've saw in a 30-year career. So there's just the intensity of the carnage that's occurring because of COVID-19. Early on, particularly when personal protective equipment and vaccinations weren't available a year ago or a year and a half ago, a lot of concerns, and there still are, about the threat of death, illness to themselves, bringing things home, their own loved ones, and then again, periodically shortages of materials that they need to provide care at the bedside or in the operating room. We dealt with in 2020, our knowledge was emerging around what therapeutics work and not. And there's a lot of things that got highly politicized during this period of time, but that really took a toll on and continues to take a toll on our clinicians, our nurses and physicians. Dr. Cordes had commented about being assigned or asked to step into areas that's outside their usual expertise. Maybe a post-op nurse having to be brought up into an ICU. They have the general skills, but they haven't been in a critical care area with so many people on so many high acuity treatments. And so that really puts people at stress, and we just need them. We need to redeploy them. Difficult making decisions on rationing or prioritizing care, though we haven't formally here in Arizona yet gotten to crisis standards. We're very, very, very close to that. I and the other senior physician leaders across the state talk on a daily basis about how close we are and the regrettable decision that'll make around having to begin to sort of limit who gets what kind of care. And that's always it's a stress on any professional or organization. And then a lot of regrets. I mean, even though our nurses and physicians have done a lot, they can't save everybody. And they're seeing people of all ages and all backgrounds and wishing that they could have done more, wondering if they could have done more. And we've seen this across the country. And a lot of this just disrupts their daily life. I think comment earlier just about childcare, their own family, sick childcare, various COVID outbreaks in elementary schools that require some alternative setting if their child is set into quarantine. So, what does this lead to from an emotional standpoint? We've got people experiencing guilt, anger, exhaustion, and these aren't mutually exclusive. Of course, they tend to overlap. Fear at any moment of time, sadness, hopelessness, frustration, a sense of loss. But really, I think this all sort of leads to this whole issue of uncertainty. Why isn't this over yet? I thought once we got the vaccines out, we'd sort of see an abatement of this terrible pandemic, and there's this ongoing uncertainty. It's just it doesn't seem to be a light at the end of the tunnel yet. So from a psychological standpoint, what we're really seeing are people that are in many ways just broken. Whether that's the individual who's is broken as a nurse or a physician or a respiratory therapist, pharmacist, might be in a unit, in a collection of professionals, and they're all some level of brokenness, either chronically or periodically. And just leave you with these images that really are the health, if you will, the title of this, the health of our healthcare workforce is really difficult right now. And I don't want to be melodramatic, but again, for somebody who's dealing with this on a day-to-day basis, it's a pretty significant issue. So what are we doing about it? And I've got a couple more slides and then I'll lead into Dr. Pipe's comments. Here at CommonSpirit Health and Dignity Health, one of the ways that we, even before the pandemic, because this has been an issue in the healthcare workforce, burnout, stress for some period of time, and the pandemic has just really put an accelerant on that. But we've tried to approach this from a fairly a very interdisciplinary, interprofessional, very comprehensive view. And always the challenge, as my team across the country put together this particular conceptual model, the challenge always with a conceptual model is it oversimplifies a highly complex problem. But as you can see, the way we tend to communicate this and think about this and build tactics around things is we have in the middle the target of fulfillment. We feel if we're just identifying burnout and mitigating that, that's a little too low of a bar. We're really trying to, over time, create clinical environments for our clinicians of all types that is professionally fulfilling and sustainable over time. So, one quadrant is a focus on developing culture and of engagement, inclusion, well-being. A lot of this is really leadership development. How do leaders lead? How do they create open, safe, psychologically safe conversations and environments that allow for a very, very healthy workplace? Up in the left-hand quadrant, we have that personal responsibility. We each have to take as good a care of ourselves as we can, whether that's psychologically, physically, emotionally, spiritually, relationally. But we want to empower that as an organization, help create the right tools and offer them to our employees. And then finally, those of us in healthcare realize it's a sub-optimized industry. There's a lot of things that make it hard to be a doctor or a nurse or a pharmacist. Electronic medical record is not the easiest piece of technology to navigate. And sometimes we don't have the staffing ratios correct. So this is the way we're approaching things. I've got a dozen plus tactics that are hanging off of each of these right now that we're doing either as pilots or looking for returns on investment in some of these things. So maybe I'll just leave you with a couple of other thoughts here. And that is, we often in life, there's all sorts of challenges in life, and we often can come to forks in the road. And, we certainly have a lot of experiences with our men and women coming back from war that can often get to the point of post-traumatic stress. And we see sequelae of that are both acute and chronic: anxiety, detachment, trouble sleeping, flashbacks, suicide. And what we're trying to do is create an opportunity and venues to work individually and collectively with our staff on really perhaps seeing this, not sugarcoating it, but really trying to see this as more post-traumatic growth, really looking at the opportunities for having a new outlook and an appreciation for life and their family's life, and what personal strength they've gained out of this process. And so this positive psychological change that gets experienced through adversity is a way we're trying to move our teams towards supporting those who are caring for people, to really help develop those deeper relationships and being open to new possibilities and having this greater sense of personal strength. Boy, I made it through this, or we made it through this shift. Greater appreciation, as I said, for life, and a stronger sense of spirituality, purpose, of however you define God. What is that bigger meaning of life that going through a difficult time can help us connect to? And so, some of the quotes that we hear and see is, a renewal with nurses and doctors. I love what I do. I believe I made a difference, even though I couldn't save everybody. A sense of compassion and grace for themselves, their team, and their patients. Look what we have done. We just came through a very difficult shift, or a very difficult week, or month, or season. Look what we have done as a team. Recognizing and celebrating the new skills, strengths, and abilities. I didn't know I had that in me, that I could actually do what I've done over the last 18 months. And certainly in our organization, really try to be very purposeful and mindful about our communication, trying to build trust, listen actively to where folks are at, build relationships through huddles and various COVID command center meetings. And really be intentional with supporting people around some of the self-care that they need: sleep, exercise, nutrition. Even early on with all the hype in Twitter and some of the other social media, really encourage people to take media breaks, because sometimes that sort of frenzy feeds into some of the distress that people are having. So I'll kind of leave you with this perspective here from those broken dishes I showed you. They poetically translated to golden joinery. Kintsugi is that centuries-old Japanese art of fixing broken pottery. And so rather than hiding the cracks, the technique involves rejoining the broken pieces with lacquered mix of powdered gold, silver, platinum. And when put back together, the whole piece of pottery looks even more beautiful than ever. And even when owning, not hiding, the broken history. So I'll leave you with this Ernest Hemingway quote, that we're stronger in the places that we have been broken. So certainly a pleasure to share that, and I'll stop sharing my screen, Colleen.
Thank you so much, Dr. Frey. And I love that analogy of the repaired broken pottery. As Dr. Pipe gets ready to give her presentation, I just want to remind everyone to feel free to enter any questions that you have in the Q&A box, and we'll be answering those after Dr. Pipe's presentation.
Are you seeing my screen?
We are, Terry.
Fantastic. Well, first of all, so great to be with you all today, and especially for Dr. Cordes and Dr. Frey. Always So privileged to be sharing your company. So, and all of these ideas are really, I think, they fit together really well, I guess. We'll talk a lot actually about personal strategies that you can use, that you can teach, that are very pragmatic. But instead of launching right into those, I do want to touch into some of the ideas that have already been talked about, and that is that individual level interventions cannot be the only thing that we talk about. Our systems are broken, our organizations are also broken. These issues have got to be acknowledged and fixed. And we can do this, we can absolutely do this, but individual levels or individual level intervention is not sufficient in order to create the conditions where burnout can be prevented or remedied. So these individual level interventions that I'll be talking to you about and that we'll be practicing together, they're not at all intended to replace higher level societal and organizational changes. And also that these things can be practiced in your life in addition to seeking therapy or behavioral health or all kinds of alternative modalities. It doesn't have to be one or the other. You can bring all of these tools into your toolbox in terms of having preventive health in your life and in the lives of others. Because as we talk, what I would like you to do is to really think about how these strategies could impact your own life, whether or not you're a healthcare professional. And I'll just pause and ask you to think about, do you know any physicians, any nurses, any social workers, psychologists, psychiatrists, dentists, veterinarians? Yes, you do. All of these are healthcare providers, and I haven't even, come to the tip of the iceberg of all of the people that fill out the healthcare team. So by acknowledging that and acknowledging that you're part of this system is really powerful, because emotions are contagious. And we have lots and lots of resources that can help. And so part of what happens with burnout, is that there is a gap between expectations and reality. And I'll talk about nurses because that's my background. Often nurses enter the workforce with extremely high expectations of themselves and of the profession. They have come through a rigorous academic preparation. They are motivated usually by altruism and wanting to make a positive change. And then they enter a work environment that sometimes is not as supportive as it could be. And over time, that stress, now this is oversimplified, but that stress, the difference between expectations and reality is stress. And that gap over time can create the conditions for burnout to be experienced. There's a natural protective process that happens here, and that is that when the self-protection is signaled in, Colleen showed that beautiful graphic of stress in the short term and in the long term, we engage in protective behaviors that sort of numb us from what's going on, the harm that could be happening. And in a small way, in a small dose, those behaviors can be very helpful. But when they're carried to an extreme, they can increase numbness. So things I'm talking about are often linked to consumption. It can be consumption of media, it can be consumption of food or drink, other substances. Sometimes numbing down is oversleeping or over-exercising. We all have different ways of numbing. But again, when carried to an extreme, that becomes a way of really signaling that cynicism and detachment that can let us know that someone is being, at risk for burnout or experiencing burnout. The problem is that the self-protection numbs us from harm, but it also numbs us from the joy and happiness in life. When we over engage in numbing behaviors, we not only miss out on the things that might be disruptive or harmful to us or cause us emotional or physical pain, we also numb down to the joy and the happiness and the contentment that we are capable of feeling. So part of addressing burnout, in my view, is to heighten the ability, the skill of mindfulness. Of course, you know I was going to talk about mindfulness. And the way that we describe it very simply is presence and focus. So Jon Kabat-Zinn has this beautiful, intentional, non-judgmental awareness of the present moment. So just being here now, not worrying about the past or the future, but as much as possible, simply being in this moment. It can be practiced in everyday life. There's a growing evidence base behind mindfulness, and it can really help us understand when we take a pause, take a breath, and remember who we are and why we are. It can help us be awake and alive to our own purpose and our meaning, our values and purpose, and lead our life grounded in that value system, that belief system. So I want to be clear about what mindfulness is not. It doesn't mean zoning out or not paying attention to the realities of the world. It's more than just breathing. We often use the breath as an anchor for the attention, but it's a lot more than that. In the mindfulness, the way that we're talking about it at ASU, it is not a religion. It is grounded in almost all faith and wisdom traditions and cultures that I'm aware of, is this value of being still and being present and acknowledging the connection and the interconnection, all of our lives, to each other and to the planet. So, and again, it is just the opposite of becoming numb or unseeing to issues and problems and challenges. It's actually waking up to what's happening and then being able to choose what action to take. So it is not being inactive. You know, we often see pictures of mindful moments where people, you know, someone is sitting on the beach with their eyes closed or on a mountaintop. Fine, that those are wonderful experiences, but we can also practice mindfulness and being awake in our day-to-day lives. So I often rely on this beautiful quote by Viktor Frankl in the book Man's Search for Meaning. He was, at the time that he thought of this, he was a concentration camp prisoner. He survived the camps and came out the other side to write about logotherapy. And if you haven't read the book or haven't read it in a while, Man's Search for Meaning is an incredible resource. And he, in that book, talks about a lot of things, but one quote is, "Between stimulus and response, there is a space. And in that space is our power to choose our response. And in our response lies our growth and our freedom." So this incredible source of agency and power that comes when we pause and choose our response. So this is just another way to look at this, is that the stress is out there. Sometimes it's changeable, sometimes it's not, depending on the situation. The stress often leads to an automatic reaction, and this can be thoughts, behaviors, and communication patterns. When we insert the second line there, when we insert just a pause for mindfulness, we can choose our response a little bit more carefully, intentionally. And in that lies a lot of power and freedom. So a lot of research is being done in how to move from mindfulness to a more positive emotional state. And I'm going to reference 3 authors here. This isn't published together to my knowledge, but it's bodies of research from Martin Seligman, Barbara Fredrickson, and Sean Achor, and they work in the area of positive psychology. And what they found is, on looking at happiness and positive psychology, they found that happiness is so much deeper than just the happy birthday, icing on the cake, candles, confetti kind of happiness. That's all well and good, but it's also, happiness is a deeper sense of pleasure, engagement, and meaning. If that sounds familiar, it's because Dr. Frey talked about it in terms of interventions to really help people go back and remember, why are they in the healthcare workforce to begin with? What's their joy, their meaning, their purpose? And so this is where happiness resides, is in pleasure, engagement, and meaning. So the positive emotions that have the most research behind them are the ones that are listed on this slide. Lots of other positive emotions exist, but these have a strong research base. And so for an experience today, what I would like to ask you to do, this will be very brief, is that as I read these words to you, I would like you to remember with as much of your body and mind as you can, what it was like the last time you felt these things. Okay, so we're going to start now. You can close your eyes if you want, or you can just stay eyes open and alert. So the last time you experienced joy, what was that like? Gratitude, serenity, interest, hope, pride. And this is the pride of a job well done, or it's not the narcissistic pride. It's more a sense of accomplishment in a pure way. So the last time you experienced pride, what was that like? Amusement. So really laughing, a big belly laugh. Inspiration. Awe. You know, in Arizona, you get 2 opportunities every day to experience awe, sunrise and sunset. Incredible. And then lastly, and powerfully, love. And this can be love. It might be romantic love, but it can certainly be all kinds of different love. So just by engaging your emotions, your spirit, your body in remembering those emotional states, you can reconnect with those moments in a really powerful physiological and psychological way. So I won't go into these in depth, but there are clearly some very research-based flourishing behaviors that you can do and probably already do every single day. The key here is to, you can look through this list as you listen, but as you're doing these activities, to remind yourself to be intentional that you are choosing these behaviors as a way of supporting your own personal flourishing. And not just that when you do this, your behaviors, your attitudes, your communication, and your physical presence really, all of those things are very contagious. And that when you show up in the world in this way, manifesting these behaviors and attitudes, you will change the environment that you're in, and others will notice, and they will hopefully benefit. So at ASU, you're probably well aware that we have the Center for Mindfulness, Compassion, and Resilience. It is your center. Please make use of it. The website is right there. Tons of free offerings there, video sessions, scripts. You can contact us and we'll come and do presentations for your group. We very much know that mindfulness is a skill set. It belongs not only in the academic and healthcare arena, but in almost every place. And so we've done a lot on equity and mindfulness, especially over the last couple of years. These are ways that mindfulness can be practiced in your day-to-day life. It can be a way that you approach your eating or your communication, your walking. Just everything that you can do can be done with intention. So it looks like we are ready to wrap up. I see Dr. Cordes. So I'll leave it there. Please know that you can have this presentation, and it also has links to some other resources for you. Thank you.
Really spectacular, Terry. I always love listening to you present. Always feel so much more grounded myself. So we have a question in the chat that I think Dr. Frey, I'll throw to you first, but Dr. Pipe, I'm sure you have some comments on this as well. Any insights onto research or steps that are being taken in the educational sphere to kind of upskill people who may have previously left the healthcare workforce for professional reasons, but now want to come back and help meet some of those staffing demands or needs? Either are you aware of elements there?
Well, yeah, I mean, as a big national company, we're always working on either repatriating and or upskilling and taking advantage of our simulation environments, our academic partnerships with ASU and here in Phoenix with Creighton University. So we got a lot of activity, particularly in the nursing piece on that. I think on a practical level, we're seeing even right now as we're getting very, very close to the end of capacity here in Arizona, regrettably. We're not only at Dignity Health, but I know my colleagues at Banner, Mayo, and other settings are doing the same thing. We're starting to move physicians, emergency room physicians up into the ICU to help support the ICU staff and anesthesiologists as we dial back surgeries, some capacity that they have to help with critically ill patients. So there's a lot of sort of audibles and nuances going on right now. And then I will say, and I know Terry and I talked about this, one of the things that's so important, I think, in the pipeline is to really be building this skill set into pre-professional and professional students. So there's work being done in partnership with ASU that we're doing in our various nursing, physician, and other paraprofessional tracks to really have them be aware of what they can do on a preventative basis. And so we have student groups and resident groups that are actually working on their own unique well-being and burnout prevention tactics. So Terry, I'll kick it to you for some other comments.
Thank you. And all of those are really important. And I think, you know, for people wanting to re-enter the workforce, and again, for nurses, the State Board of Nursing can be a really good resource, a starting off place of how to, what do you need to get reskilled at and how. And for people who are entering now into the workforce, we're finding a lot of supporting research on nurse residency programs, and those are programs that take a new graduate with, you know, a new grad RN and give them some time in the practice setting with careful mentoring, careful experiences that are meant to ease that transition, because it is a very stressful transition. And the first year of practice is when we lose the most nurses, not only for the current position, but they leave nursing, period.
There's another question about how, you know, COVID really shone the spotlight on many of the challenges that had been pre-existing in terms of workforce stress and burnout and shortages and all of those kinds of things. The offers of assistance to really support healthcare providers kind of came late in the game. Do you anticipate that future emergency plans and pandemic planning or kind of resource expansion will include attention to these areas from the get-go? Keith, you talked a little bit about some of the organizational changes you are addressing right now. That might be kind of a good jumping off point for us.
Yeah, I think, you know, we just had hosted here in Phoenix about 6 weeks ago, the annual meeting of the American Physician Health Conference. So I was working with colleagues from around the country listening to stories. I think those organizations that were ahead of this a little bit more than some of us fared a little bit better because they had some of the pieces in place. I will say, and Terry knows this as well, I think there's a lot of nice things that are silver linings that are going to come out of the pandemic here in Arizona, one of which is about a year ago with kind of 12 anchor organizations, including ASU, Dignity, Honor, Mayo, Department of Health Services, the Nursing Association, the Physician Association. We created a Arizona Wellbeing Collaborative. So we have an interprofessional, interagency footprint really now to build upon learnings, best practices, and really a series of toolkits. Now it's embryonic, frankly, right now, because we're all pretty distracted, but I think we've got the backbone to build on. And I know part of the Arizona Emergency Recovery Plan, this is a really important piece of that, is workforce sustainability. So I think once we get through this and get a little bit of a breather, I think we're going to see a lot more work put into this in the future.
I would agree with that, and I don't have too much to add.
You both have expertise in interprofessional teams and teamwork. What do you think the role of interprofessional teams are in mitigating some of the challenges that healthcare professionals are experiencing right now?
Maybe I'll just briefly say, I think what we learn time and time again is that you never know what someone comes to work with. You know, you never know the suffering that is carried within a person. And so to me, interprofessional caring, really being empowered to care for our colleagues across discipline, across profession is really important right now. Understanding that, the suffering isn't often seen physically. There's a lot that happens internally. And so I think that is a really important jumping off point, is, acknowledging the humanity in each other.
Couldn't agree more. I look back over the arc of my career. I mean, I think times that I've been on enjoyable, high performance teams have been interprofessional. There's been a tight knit. I mean, we weren't in a pandemic. We were, you might be in an intense situation with a patient in intensive care or labor and delivery or an emergency room. And I think that sense of cohesion that you have of a team, regardless of your terminal degree, working together every day. My belief, and I think this probably needs to be studied more, I think that's a mitigating effect. And not that we don't have our own personal stress, but I do think if you have a group of colleagues, folks that are, that are journeying with you, that can, sort of know when you're starting to look like and may not have verbalized some burnout, that they can kind of sort of come alongside you as a peer. So, and then I think those of us who are in this field, I think regrettably, we train in silos, but healthcare is a team sport. And the more we can really be bringing folks pre-professional, professional school together to have experiences, I think that'll help accelerate the mitigation effect of this. So Mike, get off my soapbox on that.
Well, I'm going to ask you to get back on your soapbox, Keith, because building off of that, when you were talking earlier about building a culture of engagement, what are some of those 10 to 12 strategies that you are doing that? Because I think that has a role with teams oftentimes as well. So how are you building that culture of engagement?
Well, in the pandemic, I have a great boss, Linda Hunt, who's been very supportive of us in spite of everything we're facing. I've been able to enrich my team this year with 2 PhD organizational psychologists to sort of help, the limited expertise I have, really sort of round this out. And so, for example, we're doing a pilot in our East Valley hospitals right now. It's a peer-to-peer training program that's evidence-based. And, we did a call, anybody who's got a full-time job, who's working in any field, whether it's in environmental services or a nurse or even the gift shop. We've had 80 folks go through an hour-and-a-half training with ongoing QA to be a peer-to-peer support. So, it sounds trite, emotional first aid, but people who just sort of have a sense of awareness that we can help leverage the workforce in this. So, I mean, that's an example. And I think a lot of our leadership programming that we're doing, working with our leaders, nurses and physicians, is being mindful or more intentional in the behaviors it takes to create an engaging workforce. Psychological safety, the way we frame this, and I think we understand this intellectually, is that the other side of the coin of well-being or burnout is high reliability. You cannot have a highly reliable, safe industry if people are burned out or distracted. So we've married a lot of that work together, that as we're taking better care of our workforce, we can sort of do more skill building and safety. And a lot of that requires psychological safety. A lot of that's the culture that the leader does, both verbally and non-verbally. So, Colleen, those are some of the tools that we're sort of laying out in the organization.
Terry, from the skill building standpoint, what would you recommend as a first step for somebody who is new to mindfulness and looking to engage and build up that skill set?
Thank you for that. So the first thing I think is to give yourself credit that you're going to take that first step, right? So gratitude to yourself. And then the second thing is to find a reliable source of information, because there's a lot of not reliable sources, right? And so I, of course, would point you to the ASU Center for Mindfulness, Compassion, and Resilience. But there are lots of other centers. And one at Berkeley is called the Greater Good Science Center. UMass Medical Center also has great resources. So find yourself a safe and knowledgeable teacher. And then just practice. You don't have to know about it. You don't have to read about it. You just have to get yourself in stillness. And that can be moving too. I mean, when I say stillness, I don't mean necessarily stillness of the body. You can walk and be mindful. You can swim, you can run, you can, dance and be mindful. It's more about spending a moment being present with yourself.
Mhm. I like that word practice with mindfulness, because I know in some of the patient care that I've done, it's a skill that we need to work on and to build up. And so giving yourself compassion for those moments when you are practicing it and maybe struggling, and recognizing that's part of the process, and just kind of coming back to that present moment can be so useful. One last question from the audience: how can revenue streams be accessed, such as portfolios supported by grants, to bring mindfulness practitioners, such as health and wellness coaches, to healthcare providers? Any thoughts on that from either of you?
So there are a lot of funding mechanisms right now that are looking at this, primarily, I think, because regulators like the Joint Commission are really looking at mindfulness as a very well-proven tool. And so the Health Services Research Administration just put out a series of calls, and Keith and I were involved with responding to a couple of those. So I think, we are seeing a greater acknowledgement, and a lot more resources will be available. So stay tuned for those. And in terms of revenue streams, once we can really say that the quadruple aim, the last aim of safety and access and quality and the health of the healthcare team, once that we can tie that last aim with reimbursement and with other, financial incentives, I think we'll see big changes.
Any final thoughts on that, Keith?
Yeah, I would agree. We don't, there's so much turnover. Terry commented that our first group of nurses coming out of nursing school, and there's other just costs that we have in healthcare. We don't typically get credit for cost avoidance, but this is one of those areas where the investment, though it seems substantial on the front end, pays long-term dividends. And I think the more we can tell that story, not only having a healthier, safer workforce, but also less turnover, I think that's the best. And we just have to sort of keep changing the mind that, we're blessed in Arizona and the United States to have a terrific healthcare workforce. We've got to take care of them.
Absolutely. Well, thank you both so much for everything today. That is all the time that we have today. We encourage everyone to follow the College of Health Solutions on social media, such as the channels listed here, so that you can learn more about other opportunities like this one. Our next Health Talks webinar takes place on Thursday, January 20th, also at noon Arizona time, and we will be addressing the topic of mandates and why they are a healthcare issue. Additional details are to be announced, and registration to open soon at asuhealthtalks.com. Thank you again, and have a great rest of your day.